We're going to go ahead and get started. And I'd like to welcome everyone to Creating Access for Community in Need with Westside Psychological Services, hosted by Dr. Cheryl Repass and Dr. Elisa Macmillan. My name is Kirk Kettinger, and I am Director of Alumni Relations at Roberts Wesleyan College and Northeastern Seminary. And we've been really enjoying these online events that we've been having for the last few months. And while we do wish we could have had this conversation with you in person, we have really enjoyed the ability and opportunity to meet with friends and alumni across the country and across the world at these events. But we hope you'll also take advantage of on-campus events and opportunities coming soon. And we hope to see you on campus in the very near future. Mental health is an important topic and something that I'm sure we all care about. And issues related to poor mental health have wide-ranging effects on individuals, families, and communities. The willingness and ability to find help and to get help can be a major obstacle for people to overcome. The Westside Psychological Services at Roberts Wesleyan College will provide opportunities for training for our clinical and school psychology doctoral students, and will also provide much needed mental health services for our community here on the west side of Rochester. And I think as you hear what we have to share today, you'll be encouraged as you learn more about this initiative, and our local community will benefit greatly from the services provided at Westside Psychological Services. The Westside Psychological Services is part of a broader outreach to the Rochester community that includes a number of institutes, most of which will be housed in the Golisano Community Engagement Center. This new facility will help Roberts reach out to the Rochester community, but will also provide much needed student gathering spaces, including a chapel. Additional institutes include the Justice and Security Institute, Business Solutions Institute, Intellectual and Spiritual Humility Institute, and English Language Institute. And each institute will provide unique opportunities for our students and the greater Rochester community. And at this time, we're going to take just a moment to show you a video, an online tour of the building, so you can get a better sense of what this building is all about. I think you can see why we're so excited about this project, and we'd love to have your support as well. We plan to break ground in the spring of 2021, so in a few short weeks, and the plan is to open the facility in the fall of 2022. And we would like to thank our alumni and friends for their prayers and the support on this project, and hope that you'll participate as well. I'd like to introduce Cheryl Repass and Elisa Macmillan, who are leading our discussion today. Dr. Repass is a professor of psychology at Roberts. She's also department chair and traditional undergraduate and graduate program co-director. She specializes in the field of school psychology and has over 15 years of experience working in schools. She earned her doctorate in school psychology from Alfred University and is a licensed psychologist. Specific areas of expertise include assessment and diagnosis with primary specialties in areas of learning and behavior, social emotional concerns and their effect on learning, autism, gifted learning behaviors, developmental disabilities, intellectual disabilities, processing disorders, and evidence-based intervention. Dr. Macmillan is the clinical director here at Roberts, and she earned her undergraduate degree in psychology and her doctorate in school and clinical psychology from Roberts Wesleyan College as well. She completed her pre-doctoral internship at Mount Hope Family Center as a trauma therapist and is currently completing her postdoctoral fellowship at the Westside Psychological Clinic. Dr. Macmillan specializes in the treatment of post-traumatic stress disorder in children and adolescents due to the occurrence of physical, emotional, and/or sexual abuse, domestic violence, community violence, and traumatic grief. She also offers parent coaching and support, as well as therapeutic intervention for families raising children diagnosed with fetal alcohol spectrum disorder. And I'll turn it over to Doctors Macmillan and Repass now for our discussion.
Good afternoon. I'm going to screen share here. Okay, I'm glad to have you join us today. Hopefully we'll be able to give you a good view of what the foundation history of creating the clinic and the services center, as well as kind of what we're doing day to day and what it looks like right now from a real snapshot view. So I'd like to just give you a brief history of where this came about. This actually was years ago that we dreamed of having Westside Psychological Services, but it began with the Greater Rochester Health Foundation actually produced some research in our community in the Finger Lakes region talking about child behavioral health and access of services. So this committee was convened in 2015, not in any way related to Roberts, but raising concern about the shortfalls that we saw in our region. And the region is broader than Monroe County. We're talking about the Finger Lakes region, so the extended counties that surround Monroe County. And so the facts and figures that this committee found and developed were the key findings that are listed here, creating this historical need. So 13 to 20% of children between the ages of 2 and 18 were experiencing some kind of mental disorder each year. And so we feel pretty confident, that knowing just about a quarter of our children in this region were experiencing something that we needed to pay attention to. The troubling spot for us was that out of that number, only 1 in 5 actually ever saw a provider. And by a provider, I mean a health provider. So a health provider can be a physician, but it overlaps with other health providers, licensed clinicians that are in the health sciences that actually would participate in the intervening need for these interrupting these mental disorders. So only 1 in 5 was a shocking ratio for us and a big concern. The other part that was very problematic was the access to care. So Monroe County is thought of as a very rich community with health services. We have many clinicians and prize areas that we get served in Monroe County, but also surrounding the county, we saw an access issue. So in our adjacent counties, they had less and less access the farther they got from Monroe County, but also problematic was the low number of clinicians available even in Monroe County, and psychologists especially, limited number of psychologists serving. There was a shortage of practitioners specifically that addressed needs of children and adolescents. That was staggering to us. Even when we had clinicians and psychologists addressing mental disorders, there was a shortfall of those that were specifically trained and felt like they had an expertise and designed treatment plan for children, families and children. So again, we were concerned about those numbers. So we also knew that an overwhelming number of our children in our region, in this Finger Lakes region, do experience trauma. And coming from a wide variety, physical, mental, environmental conditions that are in our community right now, that are different than maybe what was there 30, 40 years ago. And we now know that this trauma is a corporate cause and a concern that we needed to pay more attention to, because the numbers were much higher and much more overwhelming to us as systems within the county. The concern long term for us was children who go without this treatment. I'm talking about the 4 that never receive support, have a 50% higher risk for a mental disorder as an adult. And that number should concern us all as it staggers into adulthood, affecting all life activities for that person, and level of independence and level of need that becomes a greater need for society. What's our response at Roberts Wesleyan College? Our first response actually wasn't this clinic. Our first response was the launch of our doctoral program in 2016. We were already linked as a psychology department to having this as a big vision for ourselves, but it became a greater vision when we knew that it would serve as an outreach to the community, producing more psychologists that wanted to work as practitioners in the field, hoping they would filter into this region. So we launched our program in 2016 and graduated our very first cohort last May during the pandemic, which was not what we planned. But spring of 2020, we saw our first 6 psychologists graduate that are working on finalizing their licensure right now, and are all working as practitioners in the field in various capacities. We still knew that even with the launch of the doctoral program, one of the things that would extend both our department and our program here at Roberts would be a specialized training clinic that could address the several needs, both departmentally and for our community. So addressing the shortfall while also addressing our training needs. One of the areas that we train in is making sure that our students have supervision by psychologists, licensed psychologists. And due to the number of shortages of licensed psychologists able to serve in this capacity, we knew that creating our own environmental training condition that we could train ourselves and supervise our own students would help our cause while meeting the needs of families and children. We also knew that the west side of the city with this shortfall was even more discrepant in services than what the east side of Rochester had available. So it would provide an access for our families on the west side that was much easier. So the development started. We had the support of the college and support of the foundational pieces of the institutes that are being created through the Golisano Community Center. And we were able to do some planning and some real work on how can we make this happen to access for our community. So we knew what it would do is address our training needs and shortages of providers for psychological services in this area. We also knew it would be able to serve both child and adult populations. The expertise of our current student population, as well as our faculty that is doing supervision with this clinic, I have adult expertise and child expertise. And so we knew that would be a good avenue to serve the community. It would also allow for program growth to provide future, what we call APA internship sites. I won't go into this as much, but APA is our accrediting body that accredits our program, and they do require internships that are accredited by the APA, and we want to be part of those initiatives. And if we have a clinic that is up and functioning, we knew that we could join an APA's system and provide sound internships where our students would get good training, year-long training in their 1,715-hour internship. The other very important thing to the college and to us as a department is this community outreach is very consistent with the values and the initiatives of our founder, B.T. Roberts. This webinar today is not a historical dissertation on B.T. Roberts, but I do want to make sure the community knows that B.T. Roberts, one of his primary foundations was to extend to the poor and to extend to those that don't have access. And the whole foundation of Roberts Wesleyan College was who developed B.T. Roberts developed and named Roberts Wesleyan College, was opened to serve poor children to have an education. Well, we know that this is consistent with his vision. And it was exciting for the psychology department to see our extension of the college and the support of the college be an extension of who B.T. Roberts was and his vision for this campus. It also allows faculty opportunities to practice in the field. I don't have all the faculty here to introduce to you today, but we have 5 licensed psychologists on our faculty today working in our department employed by Roberts Wesleyan College. That not only provides a depth of training and instruction for our students, but it also provides a depth that the community can access. We have those that are adult. There's expertise in adult, as I said, and childhood even down to preschool age 2. And that is a great depth for this area to tap into. It also it addresses the immediate need, as I said, to the lack of services on the west side specifically. What I thought would be what Elisa and I thought would be the best situation today for all of you to learn more about our clinic is kind of to have a Q&A between Elisa and I. And so what I'm going to do is post some questions and allow you to get a better meet and greet with our Dr. Macmillan, who is the clinical director, and she does the day-to-day work around the clinic. We encourage questions that we don't address. We encourage you to ask them. We want to interface in that way. But I would like to open up and let you meet Dr. Macmillan by first asking her to describe her role in the clinic. So Dr. Macmillan, please feel free to go ahead and describe your role.
Thank you. So yeah, I'm very excited. This is a new role for me. As Dr. Repass has indicated, the clinic is brand new. So my day to day, is really overseeing the daily operations. So things like marketing decisions and networking with other area providers and schools, managing the budget. Not my most fun thing, I'll be honest, but it is in there. And then setting short-term and long-term goals, and helping to sort of guide the vision forward. And of course, ensuring best practices. So those are kind of the day-to-day the things. And then, I also see clients. I'm a practicing therapist, which I absolutely love. Um, so seeing my clients and then supervising our practicum students who are also seeing clients and conducting evaluations. And so when I say practicum students, students in our doctoral program have to be in at least their second year, so that they've had the requisite courses that they need to be able to do the work, at least at that, entry level. And then, we provide the additional support that they need and the supervision that they need throughout. So doing that. And so, in addition to creating a safe space for our clients, we're also working towards providing that safe space for our students as well. They're coming in pretty new. And so we want to make sure that they're not just shaping and strengthening their clinical skills, but that they're also, able to grow their professional identity, integrate that identity, with their person, and really be able to develop, something we call cultural humility and cultural competence or responsiveness. And that's super, super important to the heart of this clinic. So that's something else that is a major focus. And for those of you who might not know, cultural humility, when I say that's a fancy term, it just really kind of means, developing the awareness that the things that I think and know and believe and have experienced are not the same for everybody. and just being able to see areas where things are different for other people, where maybe there's, power differentials, where people may not have access to things that they need and the things that they deserve, and really being willing to sort of advocate for others, partner with other people to advocate for others, and to really be able to bring about more equity. So, and then cultural competence or cultural responsiveness is really the ability just to understand and appreciate and work with people who are different from us, in ways that are respectful and safe. So, and then because that's not enough. I like to do more. Really focusing in on helping our students develop self-care, right? And they need that because if they don't have that, if they're not taught and have the opportunities to practice engaging in self-care, and by that I mean, actually doing things like eating and sleeping and exercising. It's not always, spa days, although we love those when we can get them. But really to avoid burnout and avoid something called secondary traumatization, another big fancy term that just means trauma from sitting with and helping others through their trauma or their work. So lots of creating of brave and safe spaces for clients, for our students, and really just encouraging them to engage in the practices that require so much vulnerability and so much courage to kind of face that sort of growth. So long answer, but that's kind of the summary of all the angles.
Great, thank you. And how long has the clinic been open?
Not very long, probably about 5 months if we don't count the first little bit in November. We launched mid-November of last year, and we had about 2 months of preparation, like hardcore preparation before we opened our doors. It was a wild ride. So December was our first full month. We started out in Carpenter Hall. Those of you who are familiar with Roberts know Carpenter Hall. It was on the first floor. Some of you may have lived in my office at one point years ago. So it used to be dorms and very small space, but we were very grateful. We had a little waiting room. It was all very cute. But the college was very kind and found some space for us in December. We moved into Voller Athletic Center, which is where we're currently located, and that's really just outside the counseling center. If you know what I'm talking about. So, we're loving the space. We have a student office and we have my office, and we're seeing clients out of those spaces. We are also very much dreaming and looking forward to bigger space in the future, which I'll talk about in a little bit. But, I'm very grateful that the college is exploring options, different places we might be able to relocate to for, more space for this full service gig that we have going on here. So, yeah.
Thank you. And what have you heard from the community so far in terms of need?
Yeah. Really exactly what you shared just a few minutes ago. Long wait lists is a big one, especially when we're talking about evaluations. You know, particularly when we start talking about evaluations for things like autism. There are very few places that are able to do that in this area. Strong's Developmental and Behavioral Pediatrics is one of them. Some of you may know them as Kirsch. They used to be Kirsch. And so the wait times for evaluations like that can range from 6 months to a year at times. And when you're a family that's really struggling with, the challenges inherent in something like that, that is a really long time to wait. So that is one of the things. Sometimes I hear, no one else does the kinds of evaluations that you do. I mean, Westside Psychological Services offers a huge list of different sorts of evaluations, ranging from, psychological evaluations that involve things like intelligence testing and can do academic testing, personality testing, all sorts of stuff. To psychoeducational evaluations that are very, very school based, very learning based. And sometimes it's just there aren't a lot of other practitioners who are providing them. Um, In terms of therapy, I've heard from some clients that they've just had inconsistency in the provision of services due to high turnover rates. We talked a minute ago about burnout. That's a real thing for therapists across the board. And so sometimes that happens. They have to change therapists midway through, um, or it's been ineffective for one reason or another. Um, and then, homeschooling families, we have had a lot of homeschooling families that have sought out our services. They have been looking for evaluations for their children. Sometimes it's not as easy for them to always access what they need to. School districts often do provide those services. Sometimes families, for whatever reason, don't want to take that route and they want to find an outside source. So we're hearing from them as well.
Yeah, and I just want to add on that same line, my background with schools, school districts have seen an increase in very complicated cases.
Yeah.
It's beyond need areas that are solely affecting child learning, which is where school psychologists find their expertise. But having this readily accessible clinic evaluators to journey with schools and to partner with schools, collaborate with schools, be a friendly and connected and school friendly place and family connector place
Mhm.
to truly serve to find these answers to tough questions for children.
Yeah.
We very much want that partnership. And so we do see that as a need that
Yeah.
we could fulfill.
Absolutely. And that is one of the things that makes this clinic so incredible and really very special is the fact that all of our students are being trained, as you said, in school and clinical psychology. So their ability to partner with, school personnel, to partner with the school psychologist or the school counselors in their efforts to support the family is really unmatched, I think.
So, how is the clinic right now managing things during the pandemic and COVID-19? Obviously, it's a real restricted time and a real hard to maneuver time.
Yeah.
What's the clinic doing?
It was really interesting to launch a clinic in the middle of a pandemic for sure. But Roberts has been incredible. The Roberts research team has provided a lot of support and a lot of instruction around how to keep people safe and really knock on wood. I'm literally knocking on my desk right now. We haven't had any issues. There have been no issues related to COVID for us. So as a general rule, we're providing most of our therapeutic services via telehealth, which is, sometimes it's via Zoom, like we're doing now. Sometimes it's through the telehealth feature that is included in our integrated medical record system. We use therapy notes. And so we've seen a, tremendous success really in terms of client engagement, client growth. We've had some really really good progress happen via that modality. But that said, we've been really mindful of the fact that that's not the most effective and sometimes not even the most ethical way to go for some of our population. Really really small children, people that may have developmental, disabilities or other challenges that make that hard. We've been mindful of that, and we have brought those people in. And also, all of our evaluation clients are in person, just by the sheer nature of what the tests involve. So, like I said, the Roberts Research team has been great. They've provided us with all sorts of materials and resources that we need to be able to properly disinfect and sanitize all of the surfaces. We keep track of just the basic information of people who've been in person for the purpose of contact tracing, should that ever become an issue. Um, and uh, and also we have our screening questions. So, clients arrive to campus, they call us up and they say, "We're here." We ask them the screening questions that you hear most places that you go these days. And as long as everything is good, meet them at the front door and bring them right on in. So it's worked really, really well so far. And of course, we require masks as we do everywhere right now.
Great. What's the clinic doing to encourage diversity and equity?
That's a very good question. It's my favorite question. Diversity and ensuring equity are things that are near and dear to my heart. And so prioritizing and celebrating diversity, ensuring equity in our clinic is truly an ever present focus. for me, and for our whole team, really. Um, and it's really an underlying driving force behind everything that we're doing. So I will admit it's a work in progress. No, none of us are perfect at all of this, but we are absolutely committed to continuing to grow, continuing to learn, and never becoming complacent. So you know, when I think about diversity and in encouraging and really requiring equity, I really think back to, it starts in the classroom in this program, the doctoral program, and even our master's programs. It starts there, talking about, you know, all of the things that are important. I had mentioned this idea of cultural humility and cultural competence or responsiveness that really starts in the classroom. And so, one of the things that I love about the partnership between the doctoral program and the clinic is that it's a really nice flow. They learn it in the classroom, they come to the clinic. I am able to strengthen that and continue to provide opportunities to explore that with them in supervision. And so that looks like exploring, their own cultural factors, the things that are present in the therapy room when they meet with clients. We bring our whole selves into therapy. And so we have to be really aware of what all of those pieces and components are, so that they don't trip us up. And also those of our clients, sometimes it's that there's big differences and we have to learn a little bit more, and we need to be aware of what those things are. And sometimes there's a lot of similarities, and we have to be really careful that we don't start making assumptions that, oh, they look like me, or they sound like me, or they have some, things in their history that are similar to me, therefore we are the same, because that's never, ever, ever the case. So essentially making space, taking into consideration everything in treatment, and sometimes it's really breaking it down to things like believing people. There are a lot of clients that come in and they just haven't been believed. And so believing them, taking them at their word, particularly when we're talking about the Black community, so, so important. Not over pathologizing things. Another big fancy word, over pathologizing. We don't want to make everything a problem or everything, some sort of symptom or function of a disorder or something like that, because a lot of things have cultural elements to them. And so it's really important to be listening and to learn how to identify what is and isn't something that needs to be targeted in treatment. And so I think about that in terms of even Christianity. If a Christian goes to a therapist who's not a Christian, potentially, not always, but potentially, they may see some of the faith practices as, being um, some sort of distorted thinking, right? We could go down all sorts of rabbit holes around what that could look like, but it's important to identify the things that are important to our clients, what things are part of their culture, and to really honor that. And as part of that, being able to identify and really hold space for things like historical trauma that they may be bringing in too. So they have their individual trauma and then historical trauma, family trauma. Um, and so, we really need to, in this clinic, really strive to be allies, to be, actively anti-racist, to create safe and brave spaces for everybody who's coming in. Um, and then even beyond that, we really are very conscientious and work hard to ensure that we're providing access to services for people who may be struggling financially, and being able to work that out, because we don't want people to not have access. That's happened too much in the past. So I guess if I really kind of try to nutshell all of that, is the idea of really partnering, learning how to partner with our clients, in ways that honor them as the experts of themselves, and be able to kind of move forward in those ways that are healthy and really validating for them. And then if I can, I know this is a lot. I have one more. Um, at a more global level, I think just normalizing seeking support for mental health services. Our society's come a long way over the years, especially recent years in this area, but we still have a ways to go. And so whether it's, that you're seeking services or someone wants to seek services for that psychoeducational evaluation to support their child in their school, growth and development, or their academic functioning, or it's to get a psychological evaluation to support personal or interpersonal functioning, even, or to obtain an accurate diagnosis. An accurate diagnosis is important. It drives effective treatment, or obtaining services, or to get an evaluation. I should say that allows you to obtain services through an organization, let's say like OPWDD, which is the Office for People with Developmental Disabilities, or it's to obtain medication management for something. These things are really important, and we need to have access to that, and we need to destigmatize that. Or whether it's even to get therapeutic support, to cope with something like depression or anxiety, or just to strengthen or heal relationships. So all of which we do provide here. By the way, shameless plug, we do provide all of those services here. So whatever it is, whatever the need is, it's important, and it has to be validated as such. Our community has rarely needed these resources and support more than we do now. I mean, we've been living through some really crazy times, and a lot of people are dealing with chronic stress, loss, whether that loss is loss of connection, work, financial stability. Some people lost people, or dealing with things like illness or prolonged isolation just from being in quarantine, and having things shut down for so long, um, or even just increased anxiety as a result of the pandemic. I have a lot of my clients are dealing with distress caused by at-home learning. I don't know if anybody watching has had that issue, but that comes up a lot of distress from just going through that. Um, and I could really truly go on and on. Community violence, all sorts of stuff, but the general idea is that there's a lot of individual and collective grief and trauma that has been incurred, and so supporting each other to access services is really important.
Okay, thank you. What is the age range of the clients that the clinic serves?
It's quite the span. Our littlest is 2 right now. Um, and our oldest is close to 70. So, really wide range, and I mean really, like, we hit everything in between. And so actually I had our office manager, Kelly Biscotti, who, by the way, is the most amazing individual, and we couldn't do half of what we do without her. I personally could not do half of what I do without her. Um, and so she actually figured out the percentages for us. So when we looked at it that way, under 18, we're seeing about 64% of our clients are under 18. Under 10, it's about 29%. And then if we look at like over 30, 30 plus, is about 32%. And most of our referrals so far have been coming from schools, pediatrician offices that we've networked with early on. And so it's been really pretty cool to see that play out that way.
And how has the clinic grown since opening, and what has been most rewarding?
It's grown exponentially. So since the first full month I said was December, so it's been about 5 months, we have seen 480% growth in our client base. Every month it goes up. And so 93% retention rate, which is amazing because retention rate just meaning that, when clients come and they get connected, they stay connected. And so currently, I'm very proud to say that we still don't have a waiting list. That's the goal, especially when it comes to providing evaluations. It's one of the beautiful things about being connected with a doctoral program. Our bench, so to speak, is very deep. Even we have, bless you, we
Sorry.
have access to students who may not be doing a placement in clinic, but are able to come in and help out with an evaluation here or there. So that's been very cool. And then most rewarding, I would say there's a few things. One, probably the top thing is, I speak to clients first before they come in. And I love that piece of what I do. So being able to listen to a potential client share their heart and their story over the phone, and being able to say, yes, we can absolutely help you. And here's how we take the next step. Um, Watching both clients and students grow, and learn and become more of who they are, is been very rewarding. And then something really specific but incredible has been, just kind of watching the unfolding of the outcome of a really well done assessment. People come in and there's a lot of confusion and there's a lot of feelings and there's a lot of frustration oftentimes. And then, we do the feedback session and they get the results of that evaluation and those answers, especially when they're therapeutically provided, I've watched it restore families in incredible ways. So that those would be my three, I think.
What are the short-term goals, Dr. McMillan, for the clinic?
So, short-term goals, what we're working on right now is expanding our valuation offerings, particularly in terms of how it relates to OPWDD. I'll say it again. That's the Office of People with Developmental Disabilities. I've been working with individuals associated with that organization, and a couple of areas of need that they've had has been what I said before: the autism diagnosis, autism evaluations. There is a gold standard measure. It's called the ADOS-2 autism screening, and it is what is primarily accepted by OPWDD for people who have autism to be able to obtain services that they very much need. And so, as you know, you and I are in up to our eyeballs with the training. We're working with a group called GAIN, and don't ask me what that acronym is because I can't remember anymore. But what is awesome about this organization is that the people who are supporting our learning are some of them are the people who actually wrote the ADOS. They're the creators of it. So that's been incredible. And that's a very extensive process that we're involved in, but a very rewarding one. So we'll be able to, once we're completed on that, we'll be able to start doing those evaluations. And that is, that's something that other providers are excited about because nobody wants people on a year-long wait list. We don't go into this field to tell people we'll get to you when we get to you, right? We want to get to them as soon as possible. So that's one. And then the other is something called, it's a sexual consent eligibility evaluation, also for OPWDD. It's something that is absolutely needed and is a protective measure for individuals. And so from what I've heard right now, no one is providing this service. And so we are on it and we want to be able to plug that hole and provide that service. So that in terms of the evaluations, we're also doing some other things like we're getting ready to send out a direct mailing, which is a letter that we've written up with our brochure and really looking at, reaching out to churches and doctors' offices on a broader scale. So throughout all of Monroe County, so that they can have direct access to us as well. And in conjunction with that, partnering with schools, we've partnered with some schools already, and we're working our way through. There's quite a few in the area. And part of that, working with schools is wanting to really be able to provide consultation, provide trainings for their school mental health professionals. Uh, One thing that we'd love to be able to do is provide CEU credits, which are continuing education credits, to help meet their need in that way as well. And then you mentioned it earlier, which is the APA approved internship site, because then we'd be able to really expand our student placement opportunities into that fourth year, which would be absolutely incredible. So those are the things that are in our immediate target right now.
Great. I want to be sensitive to our time, Dr. McMillan, to make sure we have questions. So the last two questions here, maybe we can quickly go through them so we
Sure.
make sure. What support and resources does the clinic need to expand our capacity to serve the community?
Okay, great question. Really simple answer. We need more space. We need a larger space. The vision is to be able to have a play therapy room complete with all of the necessary toys and sand trays and things of that nature. We need a group therapy room. We want to be able to offer that service. And we need conference rooms for trainings and things like that. We also really need to be able to panel with insurance so that we can take insurance because that will only serve to further expand access to these services for people. And then I would really love if our clinic was able to have sort of some way to provide scholarships for families in need, particularly in terms of accessing evaluations. So looking into that and how to set that up would be really impactful. And so, um, and then really, I'd love to have a med provider on site as well, eventually a psychiatrist or a psychiatric nurse practitioner to really round out that full service um, provision.
And what's the best way to reach the clinic?
The easiest way is to go probably to Roberts. Our website is roberts.edu/WPS. It's the easiest. We're also all over social media. Thank you, Kelly Biscotti. So you can access us there, and then you can give us a call. I know we had our phone number on the slide, but my personal line is one digit off from that. It's 594-6722. So you can call me directly as well.
Great. Thank you. I will I will turn it over to Michelle and Kirk.
Yes, thank you so much, Cheryl. For those of you who don't know me, I'm Michelle Blakeman. I'm Director of Engagement and Communication. You get a lot of the emails from me. I'm going to help just monitor some of the questions that have come in from the audience. If you do have any questions, we'd love for you to put them in the Q&A for us so we can see those and share the answers. And then we will wrap up shortly to make sure you get out on time. All right, so we have a question from the audience. What diversity do you have for language access? We had someone asking, are there any Spanish speaking providers?
Yeah, that's a great question. Currently, to my knowledge, we do not. However, I know that there are agencies that provide interpreting, which would be something that we would absolutely access if we needed to do that. Hasn't been an issue yet, but when it does, we will find a way.
I will add too, interesting in our training program, we do have some second language fluent speakers of Spanish specifically. And one of our clinicians that I'm thinking of does know how to administer psychological evaluations in second language of or primary language of Spanish. So what we would do first probably is access our student base if we had that available first, and then we would do, of course, what Dr. Macmillan said.
Wonderful. And part of one of the questions was, are there any MSW or LCSW clinical social workers on staff?
Well, at I'll speak a little bit to that, Dr. At Roberts Wesleyan College, of course, we have a wonderful MSW and undergrad BSW program here at Roberts that is has a rich sourcing of students. We have not, because we are the generators of this new initiative, we have not partnered yet with doing that. I know a long range plan would be a full service clinic. What you heard Dr. Macmillan say is truthful about the space. The expansion of the clinic is dependent on more space, more access, but what we see is cross-disciplinary provision being a way we would like to go. And obviously clinical social workers are one aspect of that, as well as nurse practitioner. We do have a new family nurse practitioner program launching at Roberts Wesleyan. So you can see our minds churning of what a full source clinic really looks like. And that is on our radar. So good questions.
Yeah, great question. Thanks, everyone. This has been so helpful, and I'm sure so many people feel encouraged and excited to see what you guys are doing in the community. So thank you so much both for your time today. We just want to say thank you to our attendees for being with us and taking the time to be with us on your lunch hour. You will be receiving a little gift from us in the mail, some Fuego Roberts roast coffee and some Roberts coasters as a thank you for being with us. Again, we are so glad for you to be here, and we hope you'll join us for more events like this in the future. So stay updated on our website. Oh, we have one last question. If those have to go, you can go. But we have one last question that came up in the chat. What are the current charges for services?
That's a good question. So it kind of depends on whether or not so in terms of therapy, if they're seeing one of the psychologists, it's $80 a session. If they're seeing a student, it's $30 a session. And then evaluations are really hard to say. I can tell you the range. It really depends on how complex and complicated they are. The really, some pretty simple ones can be as low as 500, and they span all the way up to 1,500, which is when you're getting into really really complex ones and the autism evaluations and things like that.
And then we have one more question that just came up. Is there's minimal access to ASL and child therapy? Would you consider jumping on board with that specific service and access?
Yeah, that's actually something that's been on my mind as well, and especially given that we're located in Rochester. And so, I absolutely is something that I'm thinking about, and I think is a fantastic question.
Wonderful. All right. Well, if there aren't any further questions, we just want to say thank you to our interpreters, Annie and Lauren. Thank you so much for your time today and providing access for our community. Have a wonderful day, everyone.
Thank you.
Thank you.